The pandemic took a lot from us. It kept us from our friends and families. As the months went on, more and more people found themselves without a job, facing new financial challenges. Their own health was not top of mind. So we know screening saves lives. According to the American Cancer Society, screenings are tests that are able to detect cancer at its earliest stages. So the American Cancer Society recommends screening guidelines for both men and for women for breast, cervical, and colorectal cancer for women, and prostate and, of course, colorectal cancer for men. Based on the pandemic, the recommendations from the American Cancer Society was to put a halt and a pause on any elective procedures. So that also included our cancer screenings. So we saw both men and women, of course, had to either postpone or cancel their scheduled annual appointments. So before the pandemic, we knew that, of course, cancer hit disproportionately, which means there's a difference on the cancer burden and the impact of cancer on different populations. So those, of course, that are at our higher risk factor based on their socioeconomic status, so where they live, how they access care, their behaviors, their health behaviors. We knew all of that impacted and their cancer burden. So that meant, of course, how their status of cancer is impacted. So either their incidence rates, their mortality, or how, of course, they access their treatment for follow-up care for cancer. So we see these disparities, especially when we look at diverse populations or those hardest hit by COVID-19, that they've had to either delay or postpone screening tests. And of course, as an impact, that could have delayed or postponed a diagnosis of cancer. So there's more of an urgency to reach out to those populations, especially those who are not routinely accessing care, who are not routinely in a medical home, and who do not routinely get screened for cancer. Everyone has a fair, equal opportunity to not only prevent cancer, but to find and detect cancer and treat cancer as well. The American Cancer Society is committed to addressing and understanding cancer health disparities. So the American Cancer Society knows screening saves lives. Everyone knows it's safe to go back to their healthcare provider, get their checkup, get back on their screening schedule today.